Hey, I'm Molly from Project Rewild Canada and the Forest Bathing Society, and today we're talking about forest bathing and cancer treatments. Cancer treatment and recovery can be physically and emotionally quite challenging, but nature has shown incredible potential to provide relief and support for patients and their caregivers. Forest therapy offers a gentle, non-invasive way to cope with the side effects of treatment, how to manage stress, and to promote healing. As a forest therapy guide who works with people undergoing cancer treatment, I get lots of questions. One of the most common questions is forest therapy safe for cancer patients? The answer is yes. When done mindfully, forest therapy is generally safe for cancer patients, but it's important to adapt the practice to the patient's condition. Since forest therapy focuses on slowing down, engaging the senses, and simply being present in nature, it can be customized for any energy level or mobility restriction. Patients can choose gentle walks, they can sit quietly in nature, or even experience nature from a window or a garden. Before starting forest therapy, it's a good idea to consult with healthcare providers to ensure that the approach is safe, especially during treatment when immunity might be compromised. Simple adjustments like avoiding overly strenuous paths or crowded areas can help ensure that the experience is as safe as it is beneficial. Unlike other forms of exercise, forest therapy does not require physical exertion because it's not an exercise. The focus is on slow, mindful movement or even stillness, which is particularly suitable for patients who may have limited energy or strength during or after treatments like chemo or immunotherapy or surgery. But we do have to consider the immune system. While nature itself can be healing, forest therapy should be practiced in environments that are clean, accessible, and free from potential infection risks for patients with weakened immune systems. This is why we opt for well-maintained paths or outdoor areas close to medical facilities if you need. Another question I get asked commonly is, can nature therapy help with chemotherapy side effects? And I like to amend that and talk about chemotherapy and immunotherapy side effects. Well, the answer is yes. Let's talk about stress reduction. One of the biggest benefits of forest therapy is its ability to reduce stress and anxiety. The natural environment has a calming effect, which can help ease the emotional and mental strain that often accompanies cancer treatment. Studies have shown that time spent in nature can lower your cortisol levels, can lower your blood pressure, and both of those help provide a much needed sense of calmness. Let's also talk about fatigue management. Fatigue is one of the most common side effects of chemotherapy and immunotherapy. And I know if you're going through it right now, I don't need to tell you that. But spending time in a forest or a natural setting can help reduce the sense of exhaustion by promoting relaxation and offering a bit of an energy reset. Patients don't need to walk far. Just sitting in nature can help alleviate mental and physical fatigue. Sitting in your front or backyard, looking out the window at a beautiful tree, all of those are beneficial. Let's also talk about nausea relief for a moment. Natural surroundings, especially environments with calming sounds like birds and flowing water, can provide a distraction from the nausea caused by chemo and immune therapy. Patients can use forest therapy as a way to escape their clinical setting, which may help them manage the discomfort. We can also talk about improvement in mood and pain management as well, because nature exposure has been linked to improved mood and reduced feelings of depression, which can be particularly helpful for cancer patients undergoing emotionally and physically taxing treatments. There's also evidence that nature can help lower pain perception by promoting the body's natural relaxation response. We also have to talk about breathing support. Chemotherapy, radiation, and immunotherapy can cause respiratory side effects like shortness of breath. Forest therapy encourages slow, deep breathing, which can improve lung function and increase oxygen intake, all while in a clean, fresh air environment. Inhaling the cytosides, those natural chemicals released by trees, like when you walk into a forest and you smell a pine forest, those are cytosides. They've been shown to boost immunity and promote relaxation, which can be helpful for patients in recovery. Another question I get asked commonly is, how should cancer patients do forest therapy? Like, how does it actually work? Well, a few different tips for you. First, I want you, above anything else, is to focus on consistency over intensity. Forest therapy can be practiced as often as the patient feels comfortable, with the focus being more on building that consistent practice rather than focusing on the length or the intensity of the sessions. Even short, frequent sessions like 10 or 15 minutes a day can bring about noticeable benefits in mood, in energy, and in overall well-being, no matter the season. Second tip is tailoring the program to the individual. That's why we bring guides. For some patients, daily nature sessions may be achievable and beneficial, while others may prefer a few sessions a week, depending on their energy levels, their treatment schedules, and their access to natural environments. The key is to listen to the body and to incorporate forest therapy in a way that feels manageable. My third tip is gradual increase. Patients may start with shorter, more manageable sessions and gradually increase the time spent in nature as they feel more comfortable. A slow-paced, mindful approach is best, allowing for more extended periods of immersion in nature as they recover and they gain more strength. If extended outdoor sessions aren't feasible, incorporating nature into medical environments, such as hospital gardens, healing spaces with plants, or simply a room with a view of trees, can offer many of the same benefits. For those with limited mobility, even a small daily dose of nature from a window or during short breaks outside can make a huge difference. So if you're not dealing with the challenge of the battle of cancer or a loved one, then why not advocate for more healing green spaces in your communities and in your local hospitals? Okay, if you want to try forest bathing for yourself, you want to dip your toe into it, then why not try your first session on us absolutely free? We call it your Rewild session. It's a little taste of how we do it here in Project Rewild. So check it out. The links are down in the description. I will see you in our next one. Happy healing from my heart to yours. And until I see you again, remember, I love you. And I'll see you in the forest.